WEHT Local Lifestyles continues.
And we're back live at the Habitat Women Build, and it's very busy. Some are doing lunch, but some are on ladders, and some are standing right next to me. This is Janelle Burton of American Senior Communities, and they visit us quite a lot on Local Lifestyles.
We do.
Thank you for coming out today.
Thank you for having us.
It's kind of interesting, isn't it?
It is. It's fantastic to see.
Lots going on. Now, you brought some activities. So what are we talking about today to keep their seniors engaged, and especially people who are suffering from dementia?
Well, we are talking about the loss of cognitive function, which can be caused by dementia, strokes, traumatic brain injuries, or multiple other diagnoses. Some things we can do at our facilities, our speech-language pathologist can work with a patient and try to restore that brain function, or come up with alternatives to restoring it, like compensatory strategies like memory books and visual cues and things like that. Naturally, by the age of 65, we're all starting a natural cognitive decline. It's considered normal aging, and that is, it includes decreased short-term memory, increased word-finding problems, decreased problem-solving skills, and slower reading rate. So
I'm not checking any of those boxes, Janelle. Those are other people.
That's
okay,
right. That's not you. You've been keeping your brain sharp, haven't you?
I have.
That's right.
Because I play all those games that you have.
That's right. So some of the things we can do to keep our brain sharp, it kind of goes the same principle as anything else. If you don't use it, you lose it. So if you're not using that brain and keeping it active every day, you're going to start to lose brain function, and you're going to see that decrease faster than somebody who is actively doing things that trigger their brain.
And this is beyond doing crossword puzzles, which is great. Other kinds of activities. So.
Those are all great activities. Crossword puzzles, word searches, staying active and reading the newspaper. Testing your own memory is a great thing you can do at home by reading a newspaper article and then trying to repeat it to a friend the next day and see if you can remember the details of it.
Retention, yes.
Yes. But there's also special games and apps that I use a lot in my therapy to kind of really trigger that brain, initiate the brain function. One of the games I use a lot is called...
Tony Maslin's over there holding the boxes. See, he can be so useful. There he is.
It's called The Last Word, and it is a critical thinking game, and it's timed, so you have to think fast and you have to think critical, and it's really fun, and my patients and I all enjoy it, and you can buy it just at, I was going to say Toys R Us, but
yes.
On Amazon or someplace like that, they will have this available, and it's a great game to use. The other game I brought that I use sometimes is called Cranium, and as it actually says on the box, the game for your whole brain. So it does a little bit of everything. It works on attention, problem solving, critical thinking, memory, and it's really fun to play with friends.
And I was going to say, I'm guessing that it also adds that element of fun and socialization because you have to play with someone.
That is correct, yes. And we can work on a lot of different things. A lot of people who've had brain injuries are really impulsive sometimes. It's a pretty common symptom with somebody who's had a brain injury, and games work so well with that, keeping them from doing impulsive things and showing them the deficits that they have.
For our viewers out there who might like to come and visit some of your communities, how can they do that, Janelle?
They can call any American Senior Community location in Evansville, Mount Vernon, or Cypress, which is in Newburgh, and our phone number at Mount Vernon is 812-838-6554.
All right. So you can take a tour, get a visit, and sharpen your skills.
That's right.
We've got to go buy all these games.
Yes.
I need some.
And we offer it inpatient or outpatient.
Even better. American Senior Communities. Thank you, Janelle.
Thank you.
We'll be back with more Local Lifestyles live at the Women Build.
This portion of Lifestyles is brought to you by American Senior Communities.